It is your favorite care girl. First time going live on YouTube in a while. Gonna be doing more of this. I'm not sure who's gonna hop on. If you have questions, I will definitely look at that and respond. First of all, I want to say happy Wednesday, happy hump day. It's Wednesday. And I want to thank everybody for coming and subscribing to the channel. If you are new here, I talk about care transitions, aging parent wellness for caregivers. That's a caregiver can be a mother of children. A caregiver can be a mother of an adult child, a mother of a aging parent, right? Foster kids, right? Caregivers are not limited just for those who are taking care of disabled or aging parents, right? I'm a caregiver. I have three children and an adult child, and my mom stays with me as well, which she's well. But if she, in the event that she needs care, it would be me helping her with that journey. And I just want to get to like why I'm doing this page and what it means to me. My For those who don't know my story, my grandmother was neglected in the home several times. She was a politician in Mississippi, and she had MS. She had MS. She eventually became total care, and I started a home care agency a few years ago, and now I'm advocating, helping caregivers advocate for their family members, just educating because what I've seen in the field that there's a whole lot of people that don't know where to start when it comes to aging care. They're not starting early enough planning. So I will be bringing on different experts talking about different ways that we can actually, get ahead of the curveball when we don't have certain information, like how to use Medicaid and how to use Medicare and what does it cover, what does it not cover, that real cost of care as well, because a lot of times people don't even know those different things, right? So, before I get into the care letter of the day, in the care letter of the day, basically, I am responding to a real live caregiver. So, I am just now reading the letters now. And basically, these are Reddit posts and I do have some actual letters people send me as well. So with their consent, I do. But this particular post is a new aging care post on Reddit that I'm gonna respond to. So this will be my first time actually like reading it. But guys, if you do have a care letter that you want to send me and you want me to respond to it live, you can actually send it to workwithme@thecaregiver.com. I'll put all that in the description for you. So let me just before I start, I want to tell people that I do have a free download, which is an emergency aging care kit, which can be used for the aging or it can be used on yourself as well. Because what I have been seeing lately, unfortunately, is a lot of sudden deaths. I don't know what's happening, what's going on. Heart attacks, aneurysms, just, young people going into surgery, not coming back out, right? So this free emergency preparedness kit, you can actually download it for yourself or download it for your aging loved one. It has like medication list. It has like power of attorney form in it. It has, what are your medical ailments, all kind of things in there that your family can have in the event that something happens to you. They have all of your details in one place, right? I always say, don't ever, let somebody know like where this paperwork is, or upload it into a Google Drive, share it privately with family members, however you want to do that, especially if it's an aging loved one. You want to make sure that everyone knows what's going on and what's happening with them. So yeah, that download will be in the description for you guys for free. Like I said, I'm doing this, and I'm doing this. The reason I'm doing this is because it's a calling on my life to help others that may need this information. Yes, I do take care of clients in Atlanta, private pay clients. We do have nurses and caregivers that take care of people. Definitely do that, and I do help families with care transitions one on one as well. So if you need that, let me know. But I'm not gonna hold y'all long today. We're gonna do the care letter of the day. I'm gonna be posting this weekly, and then I'll respond to this. And if there is anybody that hops on and has a question, I'll answer that question after I go through the letter. Okay. So here it goes. My mom lives alone 3 hours away, and I worry about her every single day. How do you cope? She's 74, sharp as a tack, but increasingly isolated since my dad passed several years ago. She has friends, she stays active, but the loneliness is real, and I can feel it every time we talk. I call her every other day, but it's never enough. She won't move closer. I've asked. She's not ready for assisted living. What kills me is knowing she has hours every day where she's just alone, no one to talk to about the small stuff. What she watched last night, a memory that popped into her head, the kind of thing you mentioned to a spouse over coffee. I've been thinking about this problem a lot and honestly considering building something to help an AI companion she could just talk to that would actually remember things about her life and check in on her. Something simple enough that she wouldn't need a tutorial. I work in tech, so I think I can manage to make something reasonably useful, but also user friendly. Before I go too far down the road, down this resonant, does this resonate with anyone here? What's your biggest daily worry about, such as app services, whatever, that actually help with isolation piece? Not pitching anyone, genuinely trying to understand if this is a real problem or just my anxiety talking. So first of all, this person is in a forum with other adult children, and I want to say that you have every right to feel the way that you feel, and a parent being 3 hours away and aging alone is definitely a scary and sad thing, right? So I would say if you could visit as much as you can, do that, and also I fleeting my beeping my own horn, I would get a home care agency or a private caregiver to check on her weekly for a companion care. Even if she doesn't need any type of care right now, eventually she may need, even if it's the bare minimum care. Having a caregiver and requesting someone maybe her age, maybe somebody just a little bit younger than her that could be more of like a friend, that would be great. So if you have a parent alone, I would say that getting a care companion, someone that they can talk to, especially if they've had their husband or spouse, her husband or wife pass, and they just are alone by themselves. Having some type of animal that is low maintenance, or you have somebody else have like a pet walker come in, or somebody that can come take care of the animal, but that animal is a companion for that senior, could even elongate their life even more, right? Just some type of companion. I love the idea of the AI companion, but again, it's not the same as a physical companion, I would say. So I would definitely get a caregiver to come in and just sit and talk and take her to the store and just play bridge with her, whatever. I never played bridge, but I just put that in there. Whatever mom likes to do, and if she may have, it might be in her benefit package where she can get caregiving. She may have long term care insurance, but I would just start with calling a local company with great reviews and go from there. And that may just increase her quality of life. And she might say, hey, I met so and so that you sent over here. And when they come in, it doesn't have to be all medical, right? Because sometimes I get cases and I'm like, hey, wear the company shirt and polos or something versus scrubs, because this person is not needing any medical care. So you don't want to come in there like you're just taking over and they're just medically, declining, right? Even if they are, it just depends on the patient. It's really not the patient. It depends on the care recipient, right? Because they may not need any care at all, right? So that's the thing. Like sometimes, like sounds like she's fairly stubborn. She doesn't want to move closer, but also you say, sometimes you can revisit that conversation and say, hey, you're getting older. I would love for you to be with us, even if it's like, okay, if she's retired, like, mom, can you come for holidays? Mom, can you come, every other month? However it is, like, even if it's not a permanent stay, let her see what it feels like for you all to be there with her, her to be with you all for a short period of time. And some people just want to be in their house. They don't want to be a burden to you, which she wouldn't be a burden if she doesn't need care. But if she eventually needs care, which she's thinking about, she's like, I don't want my kids to see me like that. And a lot of times it's dignity. It's dignity. A lot of times it's them not wanting to see you letting you know that they're aging. And something she may have some issues that she doesn't even want to bother with her daughter with, right? And that's serious. That's a lot. Like some people just don't want people to feel bad or sorry for them. They just want to deal with it on their own or not deal with it and just age in place and hey, I'm getting older and I'm gonna die. Like some people just are like that. So I think since this person is a tech person, and let's try the AI companion first, but nothing beats that heart to heart human connection. That's basically what I would suggest for this. I hope this letter helped someone, and my take on what you should do help someone as well. It is the Care Girl. This is the Care Girl podcast. This is your Dear Care Girl series. I would love to hear from you all in the comments, and you guys have a blessed day.